All right, good morning, everyone. Greetings here from Sydney, Australia. Welcome to our first International Nursing webinar series. The very purpose of this international webinar series is to highlight the current nursing researches of our colleagues in the Southeast Asian region, in particular, as well as in the Asian region. So we hope that this series will be a start of fruitful educational engagement in the years to come. Okay, as I've said, this is the inaugural event. Joining me in this event are representatives from the Philippines. With us is Mr. Rosello Ocampo. Rosello Ocampo is the Assistant Research Director of UNESCO. This is a public college based in Negros Oriental in the Philippines. Occidental, sorry. And you also have Fitzgerald Haminet. He is the Assistant Professor of the Pamantasan ng Lungsod ng Pasig in the Philippines, basically in Metro Manila. We'll be expecting another reactor from Indonesia. Hope he would be able to join us in a little while. Okay, so without further ado, I would like to introduce our inaugural presenter. Our inaugural presenter is Dr. Asmah Husaini. She is the lecturer of the Institute of Health Sciences, University of Brunei Darussalam. She received her PhD in nursing science recently from the United Kingdom. And at this juncture, she is going to give us a presentation about facing the challenge of educating the millennial nurses of the 21st century. Welcome, Asmah.
Thank you very much. It's a privilege to be here and meeting everyone internationally this morning. I hope it's morning in Sydney.
Yeah, pretty good here, pretty good. Yeah.
Okay, great. All right, so whenever everyone's ready, I can start?
Yes, right.
Yeah. Right, okay. So I'm gonna talk about, well, basically share with you the challenge of educating the millennial nursing students in Iraq. Okay. Right. So before starting, I think I'll give you a brief introduction. I have been lecturing since 2008, so that's about 10 years of teaching. I started with teaching diploma students before we embarked into integrating the nursing course to a degree program at the Universiti Brunei Darussalam, and that's when I first met Professor Jerome Babet in Brunei. So the aim of today's session is I want to share my experience over the last 10 years on how I managed to stay engaged with our students, taking into consideration of the generation gap in teaching and learning. And at the end of the session, I hope it can create a platform where we can discuss the challenges all of us face globally in teaching the millennials group today. So just a brief introduction. So the millennial generation are said to be those who were born in 1982 through the year 2000, early year 2000. Some say 2004, some say 2006. Some say those who are born beyond 2004, they are the post-millennial generation. So what's unique about this group of people is that they are born into the era of a digital age where internet is their way of life. It is embedded into their way of life. So it reflects in how they perceive things and they set their mind framework. So among the general attributes of the millennials are they do not engage well in passive learning, just as when we were taught in the past, where it is basically lecture orientated. It is one way. So today they prefer engaged learning, very active learning, and also their preference of technology. They prefer the iPad or the laptop. This reflects how they are in preference of portable learning environments. So they don't like to stay in one place. They want to be in a cafe. They want to have a discussion in a garden. Obviously, that's possible in a cold country like Sydney maybe, but not in Asia. We face challenge there.
Yeah.
And their mode of communication between student and lecturer, they are preferring texting, email. In fact, email now is also outdated. They prefer WhatsApp, instant messaging, messaging through Instagram to allow them to express their ideas. So we have, as an educator, we have the challenge because we are not born into the digital age, yet we have to set our mind frame to be able to engage to these group of students who are born into the digital age. So we need to set a very creative approach on how to level with them in terms of communications, because the way they express their ideas are totally different from when we were trained as nursing students in the past. So this is the environment that they often prefer to be in. So that's why we need to be aware on how to create a learner-centered classroom environment or discussion environment. So this presentation is really to share with you how we answer to this challenge in UBD, Universiti Brunei Darussalam in general, and specifically to the Institute of Health Sciences.
Thank you.
All right, so a little bit of introduction of the program in the University of Brunei Darussalam. So the undergraduate program in general throughout the university is called the GenX degree. So GenX degree believes in student-centric approach to education. So the curriculum is designed to equip students to have skills of critical thinking, reasoning, and communication. And in the past 10 years, we also try to embed entrepreneurship, leadership, and innovation into our curriculum. And towards the end of this presentation, I'm going to show you how that has been distinct in the past 2 years of my teaching experience. So the GenX curriculum is designed to enhance students' knowledge and competency in their specific discipline areas, for example, nursing, midwifery, medicine, as well as integrating the broad-based knowledge outside their major discipline. So this curriculum allows them to take cross-faculty courses, which we call the breadth courses. And another unique aspect of the GenX is that in the year 3, we have a program called Discovery Year, where they can get in touch with the industry or take courses that is outside of their profession discipline, but yet it can be integrated. So I think the last few years have seen a success in this program, despite the challenges that we do face on a yearly basis, on an academic yearly basis.
All right, okay.
Right. So using the GenX degree, how do nursing and midwifery take advantage of using this curriculum to stay engaged with the millennials, all right? So the traditional values of nursing care requires sensitive communication skills and empathic humanistic approach to understand patient care needs. And this value can only be taught by staying engaged with students, sorry. If we lecture them about these values, the risk is that we do not cross over that communication gap between our generation and the millennials. So I have learned that the millennials' constant engagement with technology had impacted their nursing interpersonal skills. This for me is the major challenge in educating nursing today. In the foundation year, we often see these 19-year-old, 18-year-old post-college, doing their degree, appearing cold and distant with their patients during their clinical practices. So how we approach this is by embracing. So all of our team members start embracing the approach of blended learning, where we use technology to enhance the approach of the traditional face-to-face teaching. Because millennials get bored easily with long lectures. Their attention span roughly lasts like 45 minutes. And once they're bored, we as educators cannot bring that value, the nursing value, crossover to them. So in the next few slides are pictures of how we embrace or integrate or embed technology into our teaching. So in the previous slide, as you can see there, we promote student engagement through smaller group discussions, okay? So this next picture is in the first year. These are first year nursing students. We have an approach called problem-based learning. So in problem-based learning, we introduce healthcare cases early on in the first and second semester of the first year. This is because we believe that the millennials are very well-informed, knowledgeable generation. They get information in a click. They Google it, they got it. So what we focus on our training is to choose which kind of information can fit evidence-based practice. So they are exposed to diabetic cases or neural cases right earlier on, but the learning objective of each cases is basically the anatomy or physiology of the reproductive system, for example, as you can see the diagram there, or the chemical reaction of the endocrine system, for example. So this happened over a span of 1 year, semester 1, semester 2. And as you can see, we use models, we use the whiteboard, we make sure that they are actively engaged in their own learning through presentation, writing notes on the whiteboard. So the Institute of Health Science building is designed to meet these needs. So here, this is a room that will fit about 7 to 10 people, students. We have like 20 rooms of this, roughly, and it promotes small group discussion. So this allows active engagement of student and educator. We also believe in big lecture as well, but in the big lecture, we try to integrate healthcare professionals earlier on as well. So for example, this is one of my long-term illness module where I invited a geriatrician to talk about frailty in the hospital care setting. So this is a lecture theater in one of the hospital in Brunei. So they are already exposed with interprofessional learning earlier on. And of course, we have our lab, we have our sim lab. This is our simulation lab. This is embedded in our university. So we assess them, we debrief them during their clinical practice and clinical assessment. And then here, this is an example where we invited physiotherapists from the private hospital to educate nursing students, medical students on body mechanics, transferring patients. So earlier on in the second year, we already introduced them on the importance of interprofessional learning. And this has encouraged them to be engaged in what's happening in the healthcare world right from the beginning. This is supposed to be a video. So me and my colleague also developed some videos on clinical practice. So before the actual practice here, we send the video to them earlier on so they can reflect on it. So what happened in this kind of setting is that the knowledge is given earlier on, and then they can Google or YouTube another version of it. So when face-to-face classes happen, that time is reserved for discussion and question and answer. And this also promotes student-lecturer engagement as opposed to one-way communication. So this is our sim lab. This is one of the simulation center established in Borneo. So we do use these facilities for international professionals as well who would want to use it. We have a ward setting like this, but also we have the sim center, which include a computer controlled high fidelity mannequin. So this mannequin is attached to a machine where you can set the response of the vital signs, the breathing and everything. And these are the students who have to react to that situation. So this is a group of paramedic students where they are given a trauma scenario and that they have to stabilize the patient. So this is the same room. As you can see, this is the mannequin. And the team of students can practice on the other side, where this side is divided by a glass mirror where assessor can take notes or and use it for debriefing after the simulation practices, for example. Okay, so this is how we embed technology into healthcare courses. And for the nursing and midwifery, we take advantage of that as well, because we have scenario of neonatal scenario, birthing scenario, a lot of scenario to be embedded, and interprofessional learning also happen at this level. Another way of maintaining engagement with our students is to include them into the community as early as possible as well. So this is one of the community projects where I work with a group of medical students and pharmacy students with doctors, specialists from our Ministry of Health. This is our geriatrician and this is our rehab consultant. So in this project, we were raising awareness about the healthcare needs of wheelchair users. So this project encouraged students to engage with the group of patients that they need to care for. So in this particular project, they talk to groups of wheelchair users, their experience, their needs, and automatically this allow them to reflect on how they are going to assess their patients if they have this medical background, for example, or medical history. This happened in the past 5 years, where we make use of the Discovery Year platform to encourage interpersonal learning. So in the University of Brunei Darussalam, there are 2 platforms that allows this. The Discovery Year, where students can do other things but nursing. And of course, it can be supported by the Entrepreneurial Village. If you remember my earlier slide, we want to embed innovation, entrepreneurship, leadership. So here, these are a group of students of different disciplines. This is a nursing student, and these 2 are engineering students. In this discussion, we are talking about how we can advance healthcare by integrating engineering technology into it. So one of the examples that we have been working on is trying to innovate the bedpan. So this innovation of bedpan is a project of this nursing student, which he carried forward from his undergrad to his master's research. He managed to patent a design of this innovation and currently seeking for funding to build a prototype that can be tested in our sim lab, which is another challenge, obviously. But as you can see in this part, we, as part of his master's project, we used the experience-based co-design approach, where we invited engineers, students from the business school, nursing student, designers, people from the industry, to give their own opinion about how we can go about to innovate the bedpan for nursing practice, for example. Okay. And then eventually in the final year, because we are very strong on evidence-based practice, final year students, all undergrad final year students across the university has to carry out research. So from the Institute of Health Sciences, from the Nursing and Midwifery program, we, in the final year, the student have to carry out a literature review in semester 1 and create a research proposal and carry out the research in semester 2 in the final year program. And to establish this exercise, we also organize Nursing and Midwifery Students Conference every year to allow students to present their results finding. And in carrying out research, we also encourage students to collect data not only from government hospitals, but also private hospitals. So this is one of my students who presented her research proposal to invite clinicians from private hospitals to embark into her research project. And this has been successful for the past 3 to 4 years, and many have already published their findings. In terms of the, so this is our success this year. I have to share this, where I make use the Entrepreneur Village platform to attract the attention of the millennials to work cross-discipline. So basically what I wanted, in this group, you can see, these 2 students are from the Faculty of Science. This is a nursing student, undergrad. This is an engineering student, master's level, and this is an engineering student from Philippines who just graduated this year with his PhD from the Faculty of Integrated Technology. So in this exercise, what I try to introduce is that, to mentor them, is that if you create something, so they create a medical dispenser. The idea that I want to sell to them is that you need this to be tested to the community, so that the community in Brunei can make use of your invention. And this requires a nursing faculty or healthcare faculty. And because we are in the era of digital age, the Faculty of Science students work together with us to integrate monitoring system that used apps, websites, and things like that. So this is an ongoing project, and we submitted this concept to the National ICT competition, and we won champion for this invention. And we are going to represent Brunei for the Asia Pacific ICT competition in November. So this kind of approach allows space for mentorship, really active mentorship. And as you can see here, these are our debriefing on our project together, and different angles are discussed, the engineering angles, the healthcare angles. So these give a very comprehensive knowledge and exposure to these millennials to face the ever-changing job market today. So as far as Gen Next program is concerned, I think this has shown a success to integrate that mindset to these millennials. Here is we presenting our project. We use the Entrepreneurial Village platform where they have weekly incubation. So weekly incubation is organized by students to share with the population of the University of Brunei Darussalam of their entrepreneurial projects. So we use that platform to share our healthcare innovation project, where we integrate the knowledge of science, engineering, and healthcare together to promote health in the digital age. So when we did this presentation, we were trying to invite students and faculty members from policy, business administration to come and join us in creating multidisciplinary projects to meet the societal needs in terms of healthcare. So for me, personally, how I use technology, these are the main things that I make use of: Instagram, WhatsApp, and Facebook. This is because I need to be at the same level with them, the millennials, on the need of staying connected and accessing information anytime, anywhere. So meeting their flexibility needs actually helped me cross over or hand over that nursing values, the nursing values in terms of educating. So WhatsApp has been great in terms of it allows us to send PowerPoints, documents, voice recorder, to as part of teaching and learning. So that's why we have moved beyond email now. They don't use email now. They now use WhatsApp. Even myself and Professor Babek, we use Messenger of Facebook. So for my module this year, I created a private group where I make sure our students register to Facebook. And this is only open to this particular module this year, where I interact with students through the Facebook platform. And I use the 1 hour or maximum 2 hours lecture time a week on discussion only. So I would post videos, I would post debriefing online as well, and they would show their engagement by providing comments. And this is the number of students that I have in that class, so 31 of them have seen this message. So I know that they are staying engaged, although that we don't see them face to face. So this is, I think, my final slide on discussion. Obviously, the challenges of maintaining student-lecturer engagement using technology has their pros and cons. And educating millennial today using the small group approach, although it is very successful, but we have challenges in terms of resources. So for communication wise, one of the challenge at a personal level is to bring them out of that gadget world. So the reason to communicate with them through gadget is to actually to raise the awareness that, you know, in healthcare practices, we have to let go of this gadget and practice empathic communication skills. So that's where the small group discussion really take advantage. And of course, I forgot to mention, we also use the role play approach, the debate approach, where we feed them information using technology, but the face-to-face time, we focus on debates and role plays. So communication is one of the challenges that I face as a lecturer when communicating with the millennials. I have to bring myself to their mindset and really understand their perspective, how they see things, which can be very different at times. And then the need to keep in trend. So the project that I have with those students from the engineering and science faculty really forced me to get outside of my comfort zone. I have to talk their language. I have to start hashtagging things so that they follow our discussion. As much as I find that very interesting, I also find that a bit challenging because it's not me. I'm not born into the digital age, not as comfortable as them. And then because mentorship happens very actively as well in smaller groups, there is a blurred lines between student-lecturer relationship. When we allow ourselves to enter the millennials world, sometimes they get too comfortable and there's a blurred line between professional and personal relationship. I would take it very positively in a sense that I take advantage of that, take opportunity of mentorship about professionalism. So when the blurred lines occur, that's when I pointed out to them, okay, this is how we are, our relationship at the personal level, but at the professional level, we still have to act this way. So if you don't take that opportunity, we are letting go these millennials into the professional world without being aware that there is a vague line between personal relationship and professional relationship. Because of this technology, we are staying connected at Facebook and Instagram, but that's not necessarily our relationship in the professional world. So debriefing in that sense is also important. And of course, the main thing about the pictures that I've shared just now is really focusing on experiential learning. And I think this is the way to go with the millennials, because information, they got it there. It's how to take that information into the experience and expose them in a form of experiential learning. And finally, of course, resources. At the moment, everywhere we are short of staff in terms of resources in nursing midwifery education. And Brunei is not excluded from resources for higher education. So if I have 40 students taking one module and I have to divide them into 5 smaller groups, that means I need 5 to 6 lecturers to accommodate that smaller group. So this has been an ongoing constant challenge with us because at the degree level, there's only less than 20 of us, and that we have to capture 4 years, 4 cohorts of students. So, but because we appreciate the need of this approach, we try to work around it. And that's where we mainly use technology, using the central learning system, the WhatsApp, the Facebook, to prepare the students before the face-to-face teaching and learning. So that is some of the challenges that we face as nurse lecturer in dealing or expressing, having a teaching learning environment for our millennials. So that's my email if anyone interested to get in touch in the future, research in this area. Of course, I make use of Facebook and Instagram as my teaching platform. So my area of interest is palliative care. So I've got a Brunei Darussalam Palliative and Supportive Care Interest Group on Facebook. Please do invite yourself there. And FarmBrew is the group of engineering, science, and healthcare students working on that affordable medical dispenser prototype. So please follow us on FarmBrew as well to follow our story, moving towards APICTA, the ICT competition in Vietnam in November. So thank you very much.
Thank you very much, Asmah. It's a wonderful presentation. Okay.
Thank you.
Well, that's really good best practice updates from Brunei. Okay, I think our Filipino colleagues will learn a lot from this. Okay. We might hear an insight from either of the two gentlemen. Can we have the first one? Fritz? Fritz, would you like to have a rejoinder of the presentation?
Sure. First, Asma, thank you for the very good discussion.
You're welcome.
Yeah. So what I got from the discussion was really actually happening in the Philippine setup, actually. But what I have just, my observation is that you are focusing more on the focus discussions, which may be one of the challenges here in the Philippines since we do not have that much of the lecturer. Just like what we have mentioned. In our university, actually, communication has been pointed out as one of the weakness this millennial group. Maybe there are, just like what you have mentioned, crossing the lines between the professional, the teacher, and relation. Yeah. And what I like as well is that you pointed out this to be a
Sorry, we pointed out.
Yeah, go ahead, Fritz.
It's good that you have pointed out the student-teacher relationship. That it could be a very or starting point for mentoring. Especially maybe ethical relationships with the students and very good.
Yeah. So can I ask a question on that? Because you claim that you're a millennial as well. How is that a challenge for you with your students?
Right. Actually, I am a millennial because as per your discussion, it is the 1980s.
Yes.
But I was raised by Gen X. I was raised by baby boomers. to make you
Yeah.
guys able to adapt their perspective will be I'm a bit
Oops.
annoyed, let's say, of those
Uh-huh.
students maybe having on their own during classes. But when you had your discussion, I realized that uh, I should be really looking onto them individually, so that
Mm,
I could really attract them more on engaging. Uh,
mm,
during-
yeah.
Yeah, thank you very much, Fritz, for that insight. Okay, from based on my experience, I got 2 points here already. Like an addition to Asma's experience is that from my experience that I want to make my teaching relevant here in this case now, because millennial students are more likely to perform better when they or our students or our professors connect their lessons to real life. Now,
Mm,
if you don't connect your lessons to real life, then there's a disconnect. There's a disconnect here. Okay.
mm, yeah.
In fact, I've read research recently, and it tells us about millennials perceive teachers or professors who listen, related, and talk to students about their lives as connected to millennial culture. And they
Mm,
saw those who are unattached or solely focused on course content as not very tuned into millennials. Okay.
mm, yeah.
Humor and use of current examples also help engage students.
Yeah.
Okay. Well, these are traditional way of delivering our teaching material somehow.
Mm,
Okay. In the same vein, in the same research, it tells us that teachers also need to explain clearly why course content is important, as well as how students will be evaluated in their knowledge of the course.
mm,
That is, they need to know what's going to be exemplary and how to strive for that. Okay. The other thing, very important, I'd like to highlight based on my experience as well, is that we need to explore new teaching methods. Okay. This has already been emphasized by Asma, but I'll try to reinforce this. Millennials want assignments that are more creative than the typical 10-page
yeah.
final paper. Okay.
Yeah.
I have that because I'm teaching in
Mm,
the pre-university here in Sydney. So I try to be creative as much as possible. Okay, millennials seem to be more experiential and exploratory learners. Okay,
mm,
they really seem to benefit from personalization and customization of assignments.
mhm,
They like to develop podcasts. There's one or two of my students did a podcast and PowerPoint presentations with audio narratives. Okay,
mm,
to demonstrate their knowledge of a psychological concept or a management concept, something like that. Okay, so in essence, I would like to highlight that when we approach the millennial students, okay, or the millennial audience, we have to make sure that our teaching must be relevant and that we explore new teaching methods. Okay, Rosella, would you like to give your insight as well?
Okay, good morning.
morning.
Okay. What I love most of your presentation is that the collaboration from different colleges. Like you incorporate engineering with nursing and the business students. That this practice is an eye opener for us here in Negros Occidental because we haven't tried doing research with other colleges, but I see in your presentation that you develop an innovation from something that is commonly what we see in the hospital, just like the bedpan, and you encourage your students to innovate something new from the common things that we use in the hospital. And I think that's one of the things that we tend to forget here. And then that we are that after this, I will share to the faculty in nursing that our research must not be focused only purely on them, but rather we have to include their critical thinking in their entrepreneurship and leadership and innovation. And that I really take note of this during your presentation. It's
Thank
very,
you.
very important for us So thank you very much, Ms.
Thank you very much. Thank you.
All right.
I think one of the things that I would want to raise question as well, as we all know, the literature on millennials are from the Western, it's a Western base. Of course, the students that you see in the photo, the students who are involved in those collaborative research projects are those who are can be classified as the millennials based on the Western literature, but not all of them are like that. So the question that I would want to raise today for all of us is our culture impacting the millennials in Asia? Like, for example, Fitz says that, well, I was raised by a baby boomer. That could have an implication on how we view, how you as a millennial view things. Because yes, in Asia, our grandparents are pretty much involved in raising the millennials as well. So their parents may not be the main people who influence their mindset, but rather their grandparents who are baby boomers, for example. So I think this can be taken into consideration when we look at our millennials, where they are and how culture have influenced their attributes as the people living in the digital age. I have to say, it is a great challenge in the past 5 years to integrate intercollaborative work. There are certain factors which we still don't know affect the mindsets of the students, and I think culture have something to do with it.
Yeah. So thank you very much for that, Asma. The good
You're
thing
welcome.
about the presentation is that it elevates, it scale up this issue at the international level, because mind you that the Brunei experience is, as I've said, a wonderful experience, but we don't know until you have presented it, and it's becoming successful. The thing is, if we have this regular sharing of best practices, this could somehow enhance our nursing practice, not only in Brunei, but also in the Philippines, but on a larger scale, it could be at the Southeast Asian level. Okay, so this in itself transcend boundaries, cultural boundaries. And I was just surprised that you have gone through all of these things. Is that perhaps one factor could be leadership coming from you, or leadership coming from the university itself? Or it could be, as I've said, go back to an individual leadership.
Yeah, definitely. Leadership and motivation at a personal level is very important. To be able to identify the platform that is given to you and take advantage of that to design your approach of student engagement in the nursing and midwifery curriculum, definitely.
Okay. Well, you don't have to answer this, Asna, but how is your colleagues responding to these innovations that you were initiating in the college or in the school?
You said I don't have to answer, right? I don't know.
Anyway.
Not everyone have the same vision or pace or direction. Everyone have their own personal approach and interests. It's an individual journey, basically, in terms of nursing education.
Fair enough. Okay. Any questions from the two gentlemen before we wrap up our webinar series?
One from me.
Okay, Fitz.
Asma, you have mentioned that you've been using, for example, Facebook and Instagram. Techniques, no?
Yeah.
I think you have mentioned it, or for example, you included the barriers from the start of the curriculum or the course, for example, during the syllabi discussion. What are the inclusions or maybe the delineation between the student and teacher in terms of the utilization, Facebook, Instagram? So,
right. You're asking about student utilization, am I correct?
Yeah.
Yeah. I think as you can see on the screenshot that I gave, those are the number of students. If you see the scene by this one, yeah, those are the number of students. So these shows me that there is a level of engagement, and at least 20% of these students have responded in terms of comments and suggestions. Some actually posted video yesterday morning to help in their written assignment. So I think that the participation is very good when the lecturer themselves are actively using that platform. There's no use of setting up the platform, but the lecturer do not use it on a regular basis.
All right.
Yeah. So that means for our generation, this is the gap that we need to cover. We have to embed it in our mindset that this is the way to communicate or stay engaged with these the millennials.
All right.
Can I add to what Asma
Hello,
just said?
Yeah.
Yeah, because I do agree with what Asma said. Because students, when I ask my students, how many hours do you spend on Facebook and how many hours do you spend on learning? Sometimes they will tell me, honestly, sir, we spend most of our time on Facebook rather than opening our books or our notes. Yeah. And this is an eye-opener for us instructors, that this Facebook, the page that we can make for our students, is an access also for us to open up their mind and for them to be reviewed and be updated of what we are supposed to deliver an education for them. And I myself is also creating group chats for my students where I gave them their assignments and they do their feedbacks about their assignments, also that they posted in specific groups, because I'm handling 5 sections right now with 35 students each. And I can make like what Asma said, just be that she make a small groups for 8 students, but mine I can just have time to or afford the time to divide my students into different groups. However, Facebook is a very good media for us to extend more time for our students and to impart more learning for them. Yeah, and I do agree with Asma.
Yeah.
All right. Thank you very much, Rosello. Okay. Anything else? So we are wrapping up this webinar series. I would like to thank Asma for this wonderful presentation. As I've said,
Thank you very much for the opportunity.
We hope that this will be the start of bigger things to come, not only in Southeast Asia, but outside of Asia somehow. Okay. May God bless everyone. Thank you very much, Fritz and Rosello. I'm wrapping this up.